Hello and welcome, and of course, Happy New Year to all of you out there. This is today's first virtual press conference on global health issues here from WHO, the first in the new year. It is Wednesday, 10 January 2024, and we are here live in the WHO headquarters in Geneva. My name is Christian Lindmeier, and I'll walk you through this press conference today. Let me introduce the participants for today. We have, of course, Dr. Tedros Adhanom Ghebreyesus, WHO Director General. Then we have Dr. Mike Ryan, Executive Director for WHO's Health Emergencies Program. We have Dr. Teresa Zakaria, the Incident Manager for Escalation of Violence in Israel and the Occupied Palestinian Territories. Then we have on the other side of Dr. Tedros, we have Dr. Maria Van Kerkhove. She's Director at Interim for Epidemic and Pandemic Preparedness and Prevention. Then we have Dr. Francesco Branca, Director for Nutrition and Food Safety here on my side, and Ms. Erin Kenny, she's Director at Interim for the Department of Gender Rights and Equity. We have a couple of colleagues online. First and foremost to mention is Dr. Richard Pieperkorn, who is our representative in the Occupied Palestinian Territories. Others we'll introduce as we get to them. With this, let's get started for this new year, and over to Dr. Tedros.
Thank you. Thank you, Christian. Good morning, good afternoon, and good evening. While many of us celebrated the dawning of the new year with family and friends, for millions of people across the world, 2024 is not a happy new year. This Sunday marks the 100th day of the conflict in Israel and the occupied Palestinian territory. The situation is indescribable. Almost 90% of the population of Gaza, 1.9 million people, have been displaced, and many have been forced to move multiple times. People are standing in line for hours for a small amount of water, which may not be clean, or bread, which alone is not sufficiently nutritious. Only 15 hospitals are functioning, even partially. The lack of clean water and sanitation and overcrowded living conditions are creating the ideal environment for disease to spread. Delivering humanitarian aid in Gaza continues to face nearly insurmountable challenges. Intense bombardment, restrictions on movement, fuel shortages, and interrupted communications make it impossible for WHO and our partners to reach those in need. We have the supplies, the teams, and the plans in place. What we don't have is access. WHO has had to cancel 6 planned missions to northern Gaza since the 26th of December, when we had our last mission, because our requests were rejected and assurances of safe passage were not provided. A mission planned for today has also been cancelled. The barrier to delivering humanitarian aid to the people of Gaza is not the capabilities of the UN, WHO, or our partners. The barrier is access. We call on Israel to approve requests by WHO and other partners to deliver humanitarian aid. We continue to call for a ceasefire, but even without one, corridors can be established to allow the safe passage of humanitarian aid and workers. We continue to call for the release of the remaining hostages, and we continue to call on all sides to protect healthcare in accordance with their obligations under international humanitarian law. Healthcare must always be protected and respected. It cannot be attacked and it cannot be militarized. Now to Sudan, where the situation is continuing to deteriorate after 9 months of conflict. Increasing violence, mass displacement, Spread of diseases such as cholera, insecurity, and looting are undermining the work of WHO and our partners to save lives. We are also deeply concerned by reports of increased sexual and gender-based violence, as well as reports of family separation and child recruitment. In the past month, 500,000 more people have been displaced from Al Jazeera state due to spread of the conflict. The state used to be a safe haven from the conflict in Khartoum and is a hub for WHO's operations. Due to security concerns, WHO has temporarily halted its operations in Al Jazeera. The state is also considered the breadbasket of Sudan, and fighting there has disrupted the annual harvest and increased the risk of food insecurity in conflict-affected areas. Even before the conflict began, many people in Sudan suffered from food insecurity. Now, it's unimaginably worse, especially for children under 5 and pregnant and breastfeeding women who are the most vulnerable to acute malnutrition. An estimated 3.5 million children under 5, 1 in 7 are acutely malnourished, and more than 100,000 are suffering from severe acute malnutrition, requiring hospitalization. At the same time, Sudan is suffering from an outbreak of cholera with around 9,000 cases and 245 deaths. Towards the end of last year, WHO and our partners supported vaccination campaigns in 3 of the most affected states. Now to Ethiopia, where WHO is gravely concerned about the worsening health crisis in parts of the country. The northwestern region of Amhara has been badly affected by conflict since April 2023. The internet is still cut off in the region, severely impeding communication with health partners and authorities. Restrictions on movement are impeding the provision of humanitarian assistance. Fighting is affecting access to health facilities, either through damage or destruction, roadblocks, and other obstacles. According to a multi-agency report, 61 health facilities have been fully damaged and 39 partially damaged as a result of the recent conflict in Amhara. Health facilities are unable to deliver training and supplies and are unable to transport samples for laboratory confirmation in many areas. Conflict, drought, and displacement are driving widespread hunger and disease outbreaks, including media reports of near-famine conditions in Tigray and Amhara. The El Nino phenomenon has affected more than 17 million people across Ethiopia. But the impact in the northern areas is particularly concerning. Disease outbreaks are spreading in northern Ethiopia as the result of conflict, drought, economic shocks, and malnutrition, especially in Tigray and Amhara regions. Over 30,000 cholera cases were reported between August 2022 and December 2023 across the country, including in Amhara, Tigray, and Afar. Cholera is also spreading in the Somali region due to recent flooding. Outbreaks of malaria, measles, leishmaniasis, and dengue are also on the rise. The most pressing need is for access to the affected areas so we can assess the need and respond accordingly. Finally, although COVID-19 is no longer a global health emergency, the virus is still circulating, changing, and killing. Data from various sources indicate increasing transmission during December, fueled by gatherings over the holiday period and by the JN.1 variant, which is now the most commonly reported variant globally. Almost 10,000 deaths from COVID-19 were reported to WHO in December. and there was a 42% increase in hospitalizations and a 62% increase in ICU admissions compared with November. However, these trends are based on data from less than 50 countries, mostly in Europe and the Americas. It's certain that there are also increases in other countries that are not being reported. Just as governments and individuals take precautions against other diseases, we must all continue to take precautions against COVID-19. Although 10,000 deaths a month is far less than the peak of the pandemic, this level of preventable deaths is not acceptable. We continue to call on governments to maintain surveillance and sequencing and to ensure access to affordable and reliable tests, treatments, and vaccines for their populations. And we continue to call on individuals to be vaccinated, to test, to wear masks where needed, and to ensure crowded indoor spaces are well ventilated. Although COVID-19 is no longer a global health emergency, there are many other emergencies to which WHO is responding, including in Gaza, Ukraine, Ethiopia, and Sudan. On Monday, WHO will release our health emergency appeal for 2024, outlining how much we need to protect the health of the most vulnerable people in 41 emergencies globally. In 2024, we aim to reach almost 90 million people with life-saving support. The coming year will be a test for humanity, a test of whether we give into division, suspicion, and narrow nationalism, or whether we are able to rise above our differences and seek the common good. Despite the many challenges we face, I remain an optimist. And WHO remains committed to doing everything we can to promote, provide, and protect the health of the world's people this year and every year. Christian, back to you.
Thank you very much, DG. And with this, we now open the floor for questions from the media. Let me remind you again to get into the queue. Please raise your hand with the raise your hand icon, and then we'll get you. And don't forget to unmute yourself when we call upon you. And we start with Belisa Godinho from W Magazine Portugal. Belisa, please, Happy New Year to you, and please go ahead.
Happy New Year to everybody. Thank you for taking my question. There are several health challenges in the world to solve at a global level. What is the most worrying emergency issue right now? Where to start? Thank you.
A big question, man. The biggest worrying emergency.
Yeah, thanks for the question. I think Dr. Tedros has outlined some very acute issues pertaining to the occupied Palestinian territories, to Sudan and to Ethiopia, but that is the tip of an iceberg of chronic, protracted emergencies around the world, and then also an increasing intensity and geographic spread of acute emergencies. I think, and I think Tedros again referred to it in his speech, unfortunately, what we're seeing more and more is a group of countries that are moving into multiple repeating crises, almost falling into the abyss of fragility, conflict, vulnerability, in which the horsemen of the apocalypse of famine and conflict and disease, historically we associate these three things together. Our populations associate these things because historically our communities have been deeply affected. When these three processes intertwine and amplify, it creates the conditions in which there's a convergence of risks, there's a convergence of those threats, and they self-amplify and create these conditions where countries can't recover from one emergency. They move from one phase of emergency led by one particular threat, be it a drought, into the next phase of the emergency, which is led by conflict, into the next phase of the emergency, which is led by famine, into the next phase of an emergency, which is driven by an epidemic, and sometimes up to 5, 6, or 7 emergencies occurring in one country at one time. So it's not that we're necessarily seeing in any particular country being the worst, but what we're seeing, if you listen to what Dr. Tedros said about Sudan, if you look at Ethiopia, you very much see very similar patterns in terms of multiple different threats occurring in multiple different parts of one large country at one time, and those threats repeating, moving geographically, moving over time, where countries have no opportunity to recover, communities have no opportunity to recover, and they're thrust from one crisis into the next. This context of fragility, conflict and vulnerability is growing. We believe in WHO that up to a quarter of the world's population will live in contexts like this by 2030. The vast majority of the poorest people in the world will live in these contexts. So the old idea that we have an acute emergency and we respond to the emergency well or badly and then we recover from the emergency, that's great. That very much is the case in many countries. And we still are faced around the world with the threat of pandemics, the threat of major emergencies. We've seen huge natural disasters last year. We've been through the pandemic together. We see different epidemics from emerging diseases occurring around the world, and that will continue to happen. But we're also seeing this really, really worrying phenomenon of long-term, protracted crises in countries. And ultimately that is driven by fragility, it is driven by increasing vulnerability, and driven by an absence of governance in many cases and conflict. So I hope that frames our concerns for you in an adequate way.
Well, thank you very much, Dr. Ryan. I understand that a couple of the journalists who raised their hands have not appropriately identified themselves. So please do that, otherwise we cannot really call upon you. And while you all rename yourselves on screen with your agency and name, maybe we want to go to Dr. Rick Peppercornhouse, our representative in the OPT, to give us a brief update on the situation there and benefit from the fact that we have him online today. Rick, please.
Yes, thank you very much. Good afternoon to all, and then, of course, a very happy New Year to all. Maybe following up on the DG's comments, I think maybe the most critical issue, what is happening now, is what we call the shrinking humanitarian space. And he mentioned the word access, and not only access towards Gaza, which needs to be increased, and there should be multiple more avenues actually getting goods into Gaza, but specifically within Gaza. And it was mentioned that for WHO and focusing on health from the 26th December was, for example, the last mission we carried out to Shifa Hospital and to one other hospital north of Wadi Gaza. Since then, we have had seven attempts to bring in medical supplies and goods north of Wadi Gaza. There was an agreement with all parties to the conflict that there is a need to have a number of hospitals operational and revive a number of hospitals in the north, at least 4 to 6 hospitals that they are operational again. Because we shouldn't forget there's an estimated 2 million people in the middle and the southern areas of Gaza, and approximately 300,000 to 400,000 people north of Wadi Gaza. Now, without being able actually to move the supplies and goods, including fuel of north, who are we punishing? We are punishing the Gazans who live there, the IDPs who live there, specifically the health workers, and of course the patients. So that's a huge concern. And the other concern is we've seen the hostilities and evacuation orders actually going more to the southern areas, to the middle areas, Khan Yunis, and that's close to the Nasser Medical Complex, but also in the middle area, close to Al-Aqsa Medical Complex. And the 3 hospitals, which are the key referral hospitals in the south, are actually Nasser Medical Complex, the European Gaza Hospital, and Al-Aqsa. And they are the referral hospitals now actually serving probably around 2 million people. Now, with these evacuation orders, and that's what's happening, and this is what I want to maybe stress, you get evacuation orders, so the population leaves, or big part of the population leaves. With that, also a big part of the medical staff leave the hospitals, fears for safety. So we've seen this happening as well in the north, that when people leave, when actually medical staff leave, it's more difficult, first of all, for ambulances, and the hostilities actually increased. It's difficult for ambulances and patients to access the hospital. It is, there's fewer staff available, but also for WHO, it becomes very complex to almost impossible actually to bring medical supplies and fuel. So slowly, very quickly, the hospital from functional becomes partly functional, barely functional, to non-functional. And this is all what we mentioned about protection. This should not happen. And the international community must not allow this to happen as well in the middle and the southern areas. And I just want to say maybe one thing to show how specific and how quickly this can change. When I was in Gaza a couple of weeks ago, I visited most of the hospitals in the south middle area and a few in the north. But one hospital in the middle area, Al-Aqsa Hospital, I found that was one of the better functional hospitals when I visited. Yes, it had 200 beds and 600 patients, so 3 times. It had a lot of IDPs, but it still had a functional ICU and a very good functional emergency ward. Well, over a couple of weeks, completely changed. First of all, it became the emergency ward, and trauma cases, they increased massively because of the hostilities and the military activities close by. But when the WHO team was visiting just last Sunday, on 7 January, only 30% of the staff were left in the hospital. 70% had already moved out because of the evacuation orders, the hostilities, etc. You might have seen the statements of Médecins Sans Frontières, which had a very well functioning, we work closer than emergency medical team, who pulled out their staff on 6 January, and MAP UK did the same on the 7th because of serious security concerns. Now, when we still talk to the hospital director, what does he want? What does he expect from us? And I think we should listen to it. He wants WHO to come back regularly, keep on bringing supplies, but also to be there, to be present. And the key question he asked is that please help protect our hospital, make sure that our hospital can be accessed. So from the 600 patients, only 145 are there currently. And the rest, they all left for Nasser Medical Complex, which are already overloaded as well. So this is just a few examples how quickly the hospital functionality can change and how important it is to protect. So we have to protect a health system which is on its knees, or I would say even worse, is close to collapse now, unfortunately, also in the middle and southern areas, and a hospital which needs to be in a system which needs to be revived in the northern areas. Over to you.
Thanks so much, Rick. And with this, we go to the next question. Thanks all for changing or adding to your names. That is indeed very helpful and necessary. So next goes to Gabriel Tidroth-Faber from Reuters. Gabriel, please go ahead and unmute.
Thank you very much. My question is related to the missions that were canceled, the medical aid delivery missions that were canceled in Gaza. I'm just wondering if you could have more detail on the mission that was canceled today. We know that the last mission, the one that was canceled on Sunday, was destined for Al-Aqsa Hospital and the Central Pharmacy, northern Gaza. Just wondering if you have more details on the one that was canceled today. And also, if you could elaborate on how deliveries are planned to Gaza based on the different situation in the country. We have the north, where there's more devastation, and the south, where there's a large population, lot of displaced people. So just wondering how the needs are evaluated in these different parts of the small enclave. Thank you.
Thank you very much, Gabrielle. Yeah, parts of this, I think, Rick, you answered already, but let's go to Dr. Rick Peppercorn for more on today's missions and the other parts. Over to you.
Yeah, I think it's, and I think also DG actually raised this as well. So I just want to stress that our teams are ready, and not only WHO teams, the one UN, because many missions have been cancelled to the north. What I understand, I think in January, 16 or 17 now out of 21 missions have been cancelled. So that's absolutely not just WHO, that's important missions on fuel, food and fuel and water, etc. And what you need for a mission to the north, and unfortunately currently everywhere in Gaza, because nowhere in Gaza is a safe place, you need what we call deconflicts, and that you can proceed safely. And if you do not get the permission, you cannot move. So our requests were repeatedly rejected. We hope and we plead that we got kind of confirmation that the missions for tomorrow to hospitals in the north is approved. So I'm a little bit like first see then believe, but I want to be an optimist here that tomorrow's mission will happen. But of course, there should not be no reason, and I think this was also stated, if there's no ceasefire, then at least humanitarian corridors, whatever we call them, humanitarian corridors, pauses, they should be allowed. And they are required within Gaza. I also want to make the point that even in the south, we have now to get into deconfliction for every mission, including in the middle areas and in the southern areas. It takes an enormous amount of planning, time, questions, delays, etc. And that should not happen. I mean, like the people should be served. And linked to that, I also want to make a plea that I think the private sector engagement is completely different, but I think it's very important. It's very much needed. I mean, you don't want Gaza to be dependent on humanitarian assistance. That will never be able to change the situation on the ground. So private supply chain should be restored, support, because finally they will be the backbone of the economy. So today's mission was going to Shifa. I just want to say Al Hilu hospital, and a patient-friendly hospital. Al Hilu was opposite our office actually in Gaza City. It's a relatively small hospital where there used to be some oncology treatment. Now it's more focused on maternal and child health. And I know that hospital well. The patient-friendly hospital is also very much focused on maternal and child health. Both have asked for specific medical supplies and, of course, some fuel to make sure that the hospitals keep running. We have planned many missions. I want to stress that as well to Al-Ada Hospital. It's further north, etc. We need to go there. That's also an important hospital for maternal and child health. And the last thing to say how quickly the situation changes. Shifa, and everybody knows that it was the largest referral hospital in Gaza, and then became non-functional for the reasons I already described. And the last time we were there, and it was more functioning as an first aid treatment, almost like an outpatient department, and referring every more critical trauma patient to for example, Al-Ahli Hospital. Currently, and there is some dialysis patients which still get treatment. It used to be the center of dialysis. And also, there's at the moment, there's a few operation theaters operating again. Now, there was an agreement that we will help to revive Shifa Hospital to at least a functional first level hospital. And for that, of course, what is needed, regular medical supplies, fuel, etc., and medical staff to be able actually to go there, etc. And that's what we are focusing on. And on the last mission, actually, we did to Shifa on 26 December. So we work close with other partners, and WHO delivered not only the medical supplies then, but also material to assist World Central Kitchen, who actually established 2 kitchens which are now operational, and that's HCC, a positive, now operational and serving 1,200 meals per day. Over to you.
Thank you very much, Dr. Peperkorn. With this, we go to Alexandra Whitney from the ABC medical team. Alexandre, please go ahead.
Great. So the question I have, I know Dr. Tedros mentioned that, given the situation in Gaza, it led to a lot of risk for diseases to be spread. Are there any particular disease that the WHO is currently monitoring that we're concerned about, like in Gaza, that might be at risk of spreading?
Yeah, thank you very much, Alexander. And this is an important one. We go here to Dr. Teresa, who can shed some light on this.
Thank you for the question. I think it's very important to mention that at the moment, what we are capturing through our surveillance systems are really just signals. So they're syndromic. So these are basically the manifestation of diseases that we are seeing. Now, the causes to these various manifestations can be extremely broad, and we don't have any means to actually verify what pathogens, so what bacteria, virus, parasite, and others are actually causing these manifestations of diseases. So that's really important to highlight because we don't know what we're dealing with. We're not fully aware of then what measures we need to put in place to actually control any diseases that are spreading. There are a lot of diseases that may actually just spread undetected, and that is extremely concerning because by the time we actually find out about it, it will be at a very late stage, for which then containing it will be extremely difficult. We know that the population, the entire population at the moment, 93% are actually categorized as not having adequate access to food, and we know that food is necessary to make sure that the body has the immunity system to fight diseases. In addition to that, we also know that living conditions are still extremely poor, lack of water, lack of access to healthcare. It has been impossible for us to actually implement even the most basic infection prevention and control. Also, that's extremely important to highlight. We have seen increased rates of reports of acute respiratory infections, diarrheal diseases, jaundice, but again, these are just manifestations of multiple diseases, and we can't get to the bottom of it because we're not in a position to even test, collect samples and test. So again, back to that importance of ending hostilities and provision of that safe space for all of us to be able to implement the very basic public health interventions to make sure that people don't die from diseases and that diseases don't spread. It's just not there. And so the more this escalation of violence lasts and the less able we are to actually do something at the early stage, and the more people live in continuous suffering without access to very basic survival necessities, then the greater our risks are to missing the spread of diseases and to have really unnecessary additional deaths and people getting sick. Thank you. Back to you.
Yeah, and just maybe to add, because it's another sign of how the system is collapsing and has collapsed in Gaza. The Gaza Central Public Health Laboratory has been in place for the last 40 years in Gaza or more. It has provided very high quality environmental and human health sampling systematically across Gaza in support of all the hospitals there. It has done the water testing in Gaza, it has done the environmental testing in Gaza, and it has provided an excellent public health service. Unfortunately, the Central Public Health Labs for Gaza were based north of the Wadi Gaza, and those labs have been put beyond use. So therefore, Gaza no longer has, and has not had for quite a while, a functioning laboratory system. So when Teresa says we don't know, the reason we don't know is not that nobody's telling us that they're having problems. They're telling us, but there's nowhere for the samples to be tested. Now, we are trying to make arrangements for samples to be taken out of the country and tested in other places, to bring in mobile labs. And this is the trade-offs when you talk about access, because do you replace a truck of food with a truck of lab supplies? Which truck has more priority? Which services need to be most acutely rebuilt? Is it to bring in water testing equipment, or is it to bring in water? And these are the trade-offs, and these are the compromises that have been made by the international partners in deciding what can be brought in, what's the highest or lowest priority. So much public health infrastructure has been destroyed or put beyond use in Gaza, that it is impossible to even contemplate. In the presence of a full ceasefire, it would be a gargantuan task to address the effective situation on the ground for public health, the effective destruction and loss of public health and healthcare infrastructure. In the context of continued intense hostilities, without an effective deconfliction system that allows, as Rick referred to a predictable means of getting access to populations, to hospitals, or even to outbreak zones, it remains quite impossible. And in that, we've heard various comments made about the UN isn't doing enough, the UN isn't doing enough. If you continue to destroy infrastructure, if you continue to destroy services at this rate, and then you blame the people who are trying to come in and support and help and provide life-saving assistance, who's to blame here? Is it the people who are destroying the infrastructure and destroying the livelihoods and destroying the services? Or is it those who are trying to help restore those services under intense bombardment, under the threat of violence? Are they the ones to blame? Rick said it quite clearly. We are ready. WHO is there. You've seen the images from the field. We are on the ground and we are serving. We can do more. We can do much more. We must be given the means to do much more. And right now, that's not possible.
Thank you very much, both, for these important points. Next goes Marie Eckles from Politico. Marie, please go ahead and unmute.
Hi there. Thanks very much for the presentation. I've got a question on a separate issue on flu. So several European countries have reported rising flu cases. I was just wondering, do you view this at the moment as more of a threat or concern than COVID, or are there other respiratory diseases as well now a greater threat, such as RSV or Mycoplasma pneumonia? Thank you.
Thank you very much, Marie, and we will go for Dr. Maria van Kerkhove for this.
Yeah, thanks very much for the question. I don't think I heard the whole thing, but I got the gist of it. Certainly, we're seeing an increase in respiratory infections across the globe due to influenza, to COVID, to adenovirus, to rhinovirus, to bacteria like Mycoplasma pneumonia that are causing pneumonias, particularly among children. Also, we have RSV causing disease in children. So this year, particularly in the Northern Hemisphere, we are seeing co-circulation of many different types of pathogens. And this is causing a significant increase in burden and hospitalizations, not just for COVID, for flu, but from these other pathogens as well. You ask, are we concerned about more than one versus the other, and that's a challenging question because the risks are similar in some age groups, particularly those who are of older age with underlying conditions, and most notably for flu and for COVID, for those who are not vaccinated. So we have a significant challenge in access to vaccines around the world. We have low demand and uptake of vaccines that are available, and vaccines for COVID and vaccines for influenza save lives, particularly among those who are most at risk, have underlying conditions, immunocompromised, pregnant women. And this is what we are really concerned about. For influenza, we are seeing in the Northern Hemisphere increases in the last several months, but it's not exclusive to the Northern Hemisphere. COVID is the same. You heard the DG talk about an increase in hospitalizations of 42%, increases in ICU admissions of 62%. That is not exclusively in the Northern Hemisphere, that's around the world. So there are a lot of concerns that we have. Among children, RSV is of note, which is circulating, and you've heard quite a lot about Mycoplasma pneumonia, which is circulating in a number of countries. You heard maybe about this in China, but it's also circulating in Europe. And Mycoplasma pneumonia circulates and has peaks every 4 to 5 years. Essentially, given the lifting of the public health and social measures, with the world opened up, these viruses, these bacteria that pass efficiently between people through the air, take advantage. Winter months, holiday gatherings facilitate this. But the big point of this is there's a lot we can do. So with influenza, there is vaccination, there are treatments, early diagnosis and clinical care is critical, same thing for COVID. But we need people to test, to get treated, to enter into the clinical care pathways, to make sure that they have access to antivirals to prevent severe disease, and most notably, to get vaccinated, especially if you're in a high-risk group. So a lot of concerns that we have right now of respiratory diseases. The data that we have for flu and for COVID and for RSV essentially goes up to the end of 2023. So this is around these holiday New Year time. So we expect those trends to continue into January through the winter months in the Northern Hemisphere. But again, for COVID in particular, we see increases in the Southern Hemisphere as well. That COVID has not taken on a seasonal pattern. So multiple pathogens, multiple threats, but a lot that we can do.
And Dr. Ryan, please.
Just add a little, because I think also when we compare the patterns for influenza in Europe last year to this year, they're pretty similar, and they're on quite a similar trajectory. What is interesting and what is of note is that the rate of positivity of samples has shot up very acutely over the last month, which means there's very intense transmission going on across Europe. What is also positive, and was confirmed in the Southern Hemisphere event earlier in the year, is that the current vaccines are quite effective at reducing influenza-related hospitalization. So it's almost the same issue when it comes to COVID. The vaccines may not stop you being infected, but the vaccines are certainly reducing significantly your chance of being hospitalized or dying. And it really means that those people in vulnerable age groups with underlying conditions, having access to, and when you have access to taking the opportunity to be vaccinated against SARS-CoV-2 and against influenza is the best investment you can make in your own health and the health of your family. But obviously, as Maria has said and Dr. Tedros said in his speech, avoiding getting infected in the first place is a good bet, and certainly reducing your risk of exposure to high doses of these viruses is a good idea. But the message is, if you're not vaccinated already and you're living in the Northern Hemisphere, the vaccine works. Get vaccinated.
Thank you very much, both. We move on to Jenny Revello from DIVIX. Jenny, please go ahead and unmute.
Hi, thanks for taking my question. I have two short ones. One is, can you maybe specify what medical supplies support aren't getting inside Gaza because as you said, the missions were being canceled. And the second one is, I understand WHO's health emergency appeal last year was 2.5 billion. How much were you able to raise for that appeal? And do you expect a higher funding appeal this year? Thank you so much.
Thank you very much, Jenny. Yeah, we'll go back to Dr. Peeperkorn for the first part, I guess, and we may come back here for the second. Rick, please.
Okay, thank you very much. I just want to say something about this infectious diseases. I think because it was mentioned, and I think it's important that there is some data, but I think what was said about the displacement, the winter, and the disrupted health, water, sanitation systems, and the high level of food insecurity, contaminated water, of course, it's a cocktail for diseases. But I think UNRWA, and I want to credit, UNRWA and the Ministry of Health, together with some WHO, there's some data, and I just want to mention two, maybe three. One, since the start of this crisis, we see more than almost 200,000 cases of respiratory infections. But take a look at diarrheal diseases under 5, more than 82,000. And on average, last year, you saw 2,140 cases of diarrhea under 5. And this year, in November 24, we saw more than 43,000 cases, so a 20-fold increase in cases. And I think this is, and everything what we say is an underestimation, not only the undercapacitation of UNRWA, WHO, and Ministry of Health actually to measure, but also the lack of access to health facilities. So the situation is likely to be worse. But I just want to mention there are some data, and I think it's what Michael is referring to. I don't know when should we call it an outbreak or not. 20-fold increase, you could almost say, is a kind of outbreak. Already, and if it is not improving the situation, I think we will expect more outbreaks like that. On the what supplies got in, we have had, I think, multiple missions, and both to the north and the south. And the missions initially was very much a push system from trauma supplies, make sure that medical equipment and trauma supplies came in. Then, of course, based on the assessment we did, we got a lot of requests. We got a request, specific request, an ongoing request for trauma supplies, but also for specifics on analgesics, but sometimes even for non-communicable diseases, and anti-diabetic drugs or psychotropic drugs. We have a problem, though. We also wanted to get functional X-ray machines and CT and MRI scanners, and we've also witnessed, unfortunately, problems getting some of those supplies in as well. So it's an ongoing supply which gets into Gaza, and we tried now to tailor much more on the specific requests. So it's still partly a push system, partly a pull system, and on the funding, let me say, and maybe my colleagues from HQ will clarify, I think, overall. But when this crisis started, the one UN and partners quickly came out with a so-called flash appeal that it was 1.2 billion. WHO leading and coordinating health. We planned for 200 for all WHO and partners, 212, 215 million for 90 days. Then we were also asked by partners and donors to, so what's WHO doing themselves? So we immediately released an operational response plan, actually from October till the end of January, with a budget of 110 million, and we secured approximately 50 million with an additional 40 million pledged. So we still need, and I think it's a very good question to raise, because we make a lot of comments and analysis, but finally we need to be operational on the ground, and we definitely need way more flexible resources. And the plan is focusing on the restoring and strengthening of the health sector, including the primary healthcare, which we never discuss anymore, maternal and child health, emergency obstetric care, mental health, non-communicable diseases. The second point that we discussed, the public health surveillance and early warning disease system, supplies and logistics to underpin that, and coordination. The last point I want to make, we are still in the humanitarian phase. There's still a war going on. I think Mike started to referring to when this all stops, and we hope sooner than later, then you get into a whole rehabilitation and a recovery phase. And only if you look at health, that will be hundreds and hundreds and hundreds of millions needed. And then I'm only talking about that sector. So yeah, this is going to be a marathon humanitarian initiative, what will be required over the coming years, I'm afraid. Over to you.
Just following up on those numbers, Teresa can give you more details on this year's appeal going forward. But in terms of our health emergency appeal last year, we appealed for $2.54 billion. And we received $1.3 billion, which represents around 50% of the total ask. That looked a little better than it might actually appear, because a piece of that, a good chunk of that, was the final SPRP, the strategic plan for COVID, which was included there, which was nearly fully funded or much better funded. So we're definitely operating at less than 50%, which is benchmarks fairly well, slightly more than the overall humanitarian received as a proportion of the budget, but still not enough to do everything that we wanted to do. But we'd like to thank the donors who contributed to that health emergency appeal. It's harder and harder, and it's tougher and tougher out there. The environment is very difficult. Donors are struggling, governments are struggling, and we really do recognise and thank, on behalf of the beneficiaries, those governments that continue to engage in funding acute health response in these situations. It saves lives, it makes a difference, and it shows that we are one people, one planet. So again, thank you to the donors who continue to support that. Teresa, if there's anything on this year's appeal.
For this year, in terms of humanitarian needs, also I'll just focus on people facing humanitarian emergencies. So Mike mentioned it earlier. So we're looking at 250 million people in need. 165 million more requires urgent health. So that's the proportion of those requiring humanitarian assistance who require health assistance. The current appeal for that health sector is close to $3 billion US, but we're basically looking at more or less a $34 cost per beneficiary. And in terms of costing, actually, this has not really changed over the years. So I do believe that there's been really strong collective effort to make sure that planning for financing health assistance to those requiring humanitarian health assistance has been as efficient as possible. And as Mike said, though, last year we saw that less than half of the requirement was met. We know that there are even bigger challenges for this year to meet these financial needs. From the humanitarian partner side, I think there's been a lot of effort to make sure that the calculation, the targeting has been as clean as possible. We've also collectively improved the methodology which we use to identify and quantify those who really need acute, urgent humanitarian health assistance. And so, yes, we're calling on all partners, all donors, to make sure that these $3 billion can be mobilized to avoid even more suffering and the loss of lives among these hundreds of millions of people. Thank you.
Thank you so very much, all of you. And with this, we come to the end. Thank you for all waiting, and apologies to those who have not now made it to ask their questions. The transcript will be sent tomorrow during the day, but you'll see the files from this briefing very soon today. Yeah, and with this, over to Director General for the closing remarks. Thank you very much.
Thank you, Christian. And thank you to all members of the press for joining us today, and see you next time. Plus, Happy New Year.